Hey there, Jeff Nelson from VegSource. Today I'm going to talk about how my wife was hospitalized after drinking a tea produced and sold by Whole Foods Market. I'm going to show you case studies of other people who were injured in the same way my wife was by this tea, and then I'm going to go through a variety of articles that look at what is the source of the poison that's in this tea, where if you drink a lot of it, you could severely damage your liver. Since this happened, I've come across people who've said, oh, I drink that tea, it's healthy, and I've never had any problem. And that's great. But does that mean they have no risk of health problems from drinking this tea, even if their liver hasn't gone into failure? There's actually some published research suggesting that people may be getting damaged by drinking a lot of this tea without realizing that it's being caused by the tea itself. I'm going to talk about a published case study where that actually occurred. So here's what happened. On Tuesday, it was January 9th, 2024, my wife, Sabrina, came downstairs, and under the skylight, I could see that she was orange in color. It was like striking. It's like she had an orangey makeup or maybe a bad spray tan or something. And one of our daughters was staying with us, and I called her to come downstairs and take a look at Mom. And she came in and said, wow, you're yellow. So I ended up taking Sabrina to the ER, where they determined she had severe jaundice and acute liver failure. She was admitted to the hospital, and 2 liver specialists spent the next few days giving Sabrina every test they could think of relating to liver function. Hepatitis tests of all different types of hepatitis that there are, ultrasound, x-rays, a CAT scan, MRI, autoimmune tests, so many more. She even got a liver biopsy. But she came back negative on all of them. There was nothing the doctors could figure out that could be causing Sabrina's liver failure. So the experts were baffled. And for a couple of days, they kept asking, did you take any medications, any supplements, any herbal treatments, anything? And she was, nope, she only took B12. That's it. I was corresponding with a doctor friend of mine around that time, and I told him my wife was in the hospital and about how her doctors were perplexed. And my friend, this is a vegan doctor, his name is Peter Rogers, he emailed me this in response. I do remember my botany professor telling me to never drink herbal teas because some were toxic to the liver. I also remember from residency some herbal tea causing liver failure. So I asked Sabrina, I texted her in the hospital, it was at night, I was at home, are you drinking any herbal teas? Then a light went on. Sabrina said she had started drinking this tea from Whole Foods and drinking it every day beginning in early December, a month earlier. It had no caffeine, and she enjoyed a couple of strong mugs of this tea on cold nights. So I went downstairs and I found the tea in the cabinet, and I texted her the herb name. It was Rooibos tea. About 2 minutes later, Sabrina sent me a link to a case report she found in a medical journal. It was called Tea Not Tincture, Hepatotoxicity Associated with Rooibos Herbal Tea. The abstract said, a 52-year-old male presented with signs of acute hepatitis and liver failure. Okay, just like Sabrina. Laboratory investigations for common etiologies were unrevealing, but history suggested liver injury secondary to ingestion of a traditional South African herbal tea made with Rooibos and buchu. What? Liver biopsy confirmed a toxin-mediated liver injury. The patient recovered liver function after stopping the herbal tea. So this was just like Sabrina. She had a liver biopsy that confirmed a toxic-mediated liver injury, and since she was in the hospital, she was no longer drinking the Rooibos tea, and her numbers had started coming down. Like Sabrina, the man in this case study had come back negative on all the tests that they'd given him. There was no liver disease of any kind. Just only evidence from the biopsy was consistent with his liver being healthy, but poisoned by some outside element, which they refer to as drug-induced liver injury. Now, high doses of certain drugs like Tylenol, ibuprofen, certain antibiotics, and so on can cause liver damage or failure, and a number of herbs can do the same. The researchers who published this case said of the patient, he noted rare alcohol consumption, but he had daily ingestion of buchu and Rooibos tea from South Africa in the last month. Now, this case was in Rhode Island, and they report contacting a liver specialist in South Africa. They wrote, consultation with a South African hepatologist revealed anecdotal cases of DILI, that's drug-induced liver damage, attributed to Rooibos and buchu herbal tea, but the exact mechanism has not been elucidated. So there were other cases in South Africa of people suffering liver damage after drinking Rooibos, according to a liver specialist there where the tea comes from. The researchers in Rhode Island concluded Rooibos tea was the probable cause of the patient's liver failure based on the timing of his liver failing after he started drinking the tea and on symptom recovery after he stopped. Sabrina and I came across several more studies that night, which I'll discuss in a minute, but we told Sabrina's doctors about this right away the next morning, and one of them said he did a deep dive into the medical literature around Rooibos. Sabrina had been brewing this tea like Starbucks brews their teas, using 2 tea bags and letting it steep for 15 or 20 minutes and become really strong. And she was drinking it every day for a month. Here are some doctor comments on Sabrina's hospital file over the week that she was there. They mention her numbers are very high but improving, and then under impression they wrote, jaundice etiology is unclear, most probably related to herbal tea. Here's another, and under impression, jaundice, most probably herbal tea. Ultimately, the 2 specialists treating Sabrina concluded that Rooibos tea was what had caused her liver failure, and they sought opinions of other liver specialists at UCLA on her case who had the same take. So here's some more of what we came across that first night after Dr. Rogers suggested herbal tea could be a cause of her liver failure. This is titled Possible Hepatotoxic Effect of Rooibos Tea, a Case Report. This was in Finland in 2010. A 42-year-old woman suddenly developed liver injury. They gave her every test they could think of, and then they write, the patient denied any excessive alcohol consumption or any excessive use of additional medications such as paracetamol, that's Tylenol, but stated that she had begun to drink Rooibos tea about 2 weeks prior to the current clinical examination for medicinal purposes. She had bought the tea, and then they give the name of the tea and where she bought it in Finland, at a local supermarket and made it according to the directions given on the packet, infusing 1 teaspoonful per cup with boiled water for 10 minutes. The Rooibos preparation was flavored with small amounts of strawberry, chamomile, and petals of daisy, but there's no evidence to suggest these plants could be hepatotoxic. Her daily consumption of the tea had been about 1 liter. After the patient stopped drinking Rooibos tea, her liver enzyme levels normalized within 1 week. And they go on to say that, other than a study done using rats, there is scant evidence that Rooibos provides any actual health benefits to people. Evidence of any health benefits in human is, however, scanty. They also wrote, it could be that the Rooibos used by our patient was contaminated by some hepatotoxic compound, such as pyrrolizidine alkaloid. Pyrrolizidine alkaloid, remember that. We're going to hear that again in a moment. Here's another paper published in 2021. It's called Rooibos, a Fake Friend. It's from France and was published in 2020. It says that there are probably a lot more people suffering from liver problems from Rooibos. They write, it is probably underdiagnosed and clinicians should think about it in case of acute hepatitis. We report a case of liver injury attributed to Rooibos. And this is what the liver experts treating Sabrina also said, that other liver doctors need to be aware that Rooibos can cause liver injury because most experts aren't aware of this. They hadn't thought to ask Sabrina whether she'd been drinking any herbal teas. So this was a case of a 63-year-old man admitted to the hospital for jaundice in 2019. No history or family history of liver disease, but the man had in fact been hospitalized 14 months earlier for the same thing, liver failure, which had a, quote, favorable spontaneous evolution. It just went away on its own, and they didn't know how he got it or why it had gone away. So after many tests and eliminating any other causes, the researchers decided it was the Rooibos tea. They wrote, by resuming the interrogatory, we strongly suspected the role of red tea. In fact, the patient remembered having consumed red tea before his 2 hospitalizations for acute hepatitis and had not taken any between the 2 periods. The commercial references of his red tea showed presence of Rooibos, essentially. Extrinsic and intrinsic criteria were met concerning Rooibos. The clinical and biological course was favorable after stopping red tea consumption. So he stopped the Rooibos, and by 6 months, his liver tests had gone back to normal. Now here's another. Hepatotoxicity due to red bush tea consumption, a case report. This was in New York in 2016, and red bush is just another term for Rooibos tea. A 37-year-old man had appendicitis and was scheduled for emergency appendectomy. His liver enzymes were all highly elevated, complicating the situation. The researchers said, "We describe a case of hepatotoxicity due to ingestion of red bush tea diagnosed during preoperative assessment of a patient scheduled for laparoscopic appendectomy. Elevated liver enzymes and thrombocytopenia detected in the patient's laboratory workup confounded the initial diagnosis of acute appendicitis, and additional investigations were required to rule out cholestasis and other causes of hepatitis." So this guy had abnormally low blood platelets along with liver dysfunction, and they concluded it was the Rooibos tea, and he recovered by stopping the tea. But he didn't know his liver was being damaged until this happened. He happened to have appendicitis, and then he had some liver tests done showing he had liver problems. How many people drinking this tea are like him, walking around with liver problems or impaired liver function that's subclinical, and they don't realize that they're damaging their liver with a product from a store like Whole Foods? Here's a brand new study that came out just a few weeks ago in January 2024. It's called Pyrrolizidine Alkaloid Contamination of Food in Africa, a review of current trends and implications. Now, recall that the Finnish doctors had said it's possible Rooibos tea could be contaminated with pyrrolizidine alkaloids. Here it says pyrrolizidine alkaloids, PAs, contamination of foodstuffs has become a topical issue in recent years on account of its potential hepatotoxicity to consumers. This review therefore highlights human exposure to PAs across Africa, focusing on their occurrence, current trends of food contamination, and their associated health implications. So basically, the study says pyrrolizidine alkaloids, PAs, are a group of naturally occurring chemical compounds found in certain plants. These alkaloids can be toxic to the liver and other organs in both humans and animals, especially when ingested in significant amounts over time. They're produced by certain plants in Africa primarily as a defense mechanism against herbivores, and they pose health risks when they contaminate food sources such as grains, teas, honey, and herbal supplements. The study says, in Ghana, trace amounts of PAs were recently detected in maize, grains, and leaves forage as a result of these common agricultural practices, while in South Africa, contamination of commercial Rooibos tea has been linked to the lateral transfer of PAs from Senecio angustifolius, a PA plant, to a non-PA plant, Rooibos tea. This clearly demonstrates that food crops could take up PAs from the soil in the immediate vicinity of a PA plant material as a result of common farming practices. So these harmful chemicals, PAs, can get into Rooibos tea because a weed that naturally has these PAs called Senecio grows close to the Rooibos tea plants, and the PAs then move from the Senecio plant into the Rooibos plants through the soil. The poison travels from these toxic weeds into the Rooibos herb that's used to make the tea by Whole Foods and other companies. And this was confirmed in a 2023 study. Here it's called Scientific Evidence of Soil Transfer of Pyrrolizidine Alkaloids Originating from Weed Species to Rooibos Tea. And the study says this is because the way they farm Rooibos plants in South Africa, where it comes from, and Senecio weeds, which contain toxic chemicals that can destroy your liver, they look a lot like the Rooibos plants that they grow next to. Maybe the laborers, when harvesting Rooibos, are not careful enough to keep the Senecio weeds out, and so you get poison in your Whole Foods tea or whatever brand of Rooibos you're drinking. And if you drink a lot of such tea, you could be headed to the hospital, like my wife was. Or you could be harming your body and not aware of it. If it doesn't completely shut down your liver, but it damages it, you don't feel well, you don't realize it's a tea that you bought that's causing it. Now, if you're only drinking a little bit of the tea from time to time, maybe you're fine, or maybe you just feel tired, or you have, brain fog or some discomfort, but you're not drinking enough to land you in the hospital. Just maybe enough to kind of mess with you without you realizing it, because who's going to think, hey, this tea I bought, at Whole Foods is causing these symptoms? Even liver doctors don't know what this tea can do up until, something like this happens. Here's another one. It's called Senecio angustifolius as the major source of pyrrolizidine alkaloid contamination of Rooibos tea. So it's saying this weed, Senecio, is what is the major source of poison that can be found in Rooibos tea. The study confirms the last one I discussed. Under highlights, it says contamination with toxic PAs is a global problem. Senecio is the main contaminant of Rooibos tea. This is a study that was done in South Africa in 2017. It looks like it was paid for by companies selling Rooibos. Under acknowledgments, it says, we wish to thank the following institutions and persons acknowledge our contributions. Martin Berg of Rooibos Limited. And here is the Rooibos Limited website. We see they're in the business of selling Rooibos tea. It says, since its inception, Rooibos Limited has expanded its horizons, becoming the trusted supplier of Rooibos to in excess of 45 countries worldwide. And the rest of the study funders are farms that grow Rooibos tea. Rooibos is an important export for South Africa. There's an estimated 5,000 South Africans who earn their living by the Rooibos tea business. This study is basically saying it's not the Rooibos that's making people go into liver failure. It's the contamination from the deadly weed that grows near it. And again, this weed can spread its toxic substances into Rooibos just by being nearby, basically through the soil, is what they say. The researchers include this map in their paper showing the areas where Rooibos is grown in South Africa and where they did a survey and tested the plants for the liver toxin. Here are photos they have showing how much the Rooibos and Senecio plants look the same. You see, you can hardly tell the difference. The arrow with the S shows a Senecio toxic weed right next to the arrow with an R, which shows a Rooibos tea plant. And then the researchers did lab tests with samples they took, and they found that only those plantations where toxic weeds were present near the Rooibos plants, only those samples of Rooibos tested positive for the liver-damaging chemicals. As it says, all Rooibos plants collected from weed-free places tested negative, Table 1, confirming the apparent inability of the Rooibos plant to synthesize PAs. It is noteworthy that the Rooibos plants, which tested positive for alkaloids, came from plantations heavily infested with Senecio angustifolias, namely 3 of 6 samples from Angatur Pakhuis and all 6 samples from Pittenberg. See discussion on lateral transfer below. Here is what they write about lateral transfer of the toxic substances into the Rooibos tea. These experiments prove beyond doubt that PAs are leached from dried Senecio jacobia material into the soil and that the alkaloids are absorbed by the roots of other plants and translocated to the leaves. Lateral transfer of PAs, therefore, also offers an explanation for the sometimes high levels of PAs detected in various other food and tea products where direct contamination seemed unlikely. Now, I sent a copy of my script for this video that I'm doing today. I sent it to Whole Foods. I had a long conversation with an executive there, a very nice guy, and someone with Whole Foods subsequently contacted my wife to speak with her. One question that I had was, does Whole Foods do any routine testing to make sure its Rooibos teas are not contaminated, since this looks like a very well-known problem that's been studied? I haven't been able to find that out, but I was told Whole Foods has escalated this issue, is evaluating it now with the people responsible for Rooibos within the company. And Whole Foods is a store where we have been customers for decades, and we like them. They have a great reputation for trying to sell healthy products. One of the biggest shocks to my wife was that it was a product that she'd bought at Whole Foods that put her into the hospital. You know, Whole Foods is a company where you would expect safeguards have been put in place in order to not, inadvertently poison people, as happened to Sabrina. Here's another study from 2021. This is called The Toxic Contaminants of Rooibos, that's a Rooibos tea plant material, as well as the herb-drug interactions may constitute the health risk factors in daily Rooibos tea consumers. It says, Rooibos tea is brewed using Apalathus linearis plant material sensitive to environmental contamination. This review covers the safety data from preclinical experiments as well as human studies and delivers a report on its hepatic activity. That means damage to the liver. Summarizing, Rooibos consumption seems to be safe in terms of hepatotoxicity. However, there may be designated a group of consumers with higher risk of liver irritation. The contamination of plant material may contribute to herb-induced liver injury. Due to the impact on CYPs, that's a large group of enzymes, there is a possible risk of herb-drug interactions affecting bioavailability of some co-administered medicines. Caution should be exercised in patients receiving the treatment with allopathic medicines to avoid untoward alteration of drug plasma concentration. So this study is basically saying if you're taking drugs that involve your liver and you're drinking Rooibos tea, it could cause problems. That's their conclusion. And here's a case report showing an example of exactly that. This is from Japan in 2013. It's called Drug-Herbal Interaction Between Tacrolimus and Rooibos Tea in a Recipient of Allogenic Hematopoietic Stem Cell Transplantation. The report discusses a case where drinking Rooibos tea affected the effectiveness of tacrolimus, which is a medication used to prevent and treat organ transplant rejection, specifically after stem cell transplants. And tacrolimus is broken down by the body by certain enzymes, and the Rooibos tea interfered with this process, leading to a decrease in tacrolimus levels and the development of transplant-related complications, all because of a tea this guy was drinking. So this highlights the need for people to be aware of potential interactions between medications and herbal teas like Rooibos that you can buy at Whole Foods. On livestrong.com, I came across this article, Risks and Side Effects of Rooibos Tea. It says, an analysis of the pros and cons of Rooibos tea shows that the high antioxidant content may offer wellness advantages. However, be aware that some side effects have occasionally been reported. Since research on the herb is limited, check with your doctor before taking it. Tip: possible risks and side effects include liver toxicity, kidney damage, and impaired fertility. Do you know someone who is trying to get pregnant? Tell them to knock off the Rooibos tea. How many food products is Whole Foods selling where you need to check with your doctor before consuming it? WebMD is another website that talks about Rooibos. It says there's insufficient evidence that Rooibos actually does anything positive or prevents any disease. They say it's, quote, likely safe, but don't drink too much, and pregnant and nursing women should avoid it, they say. On the interactions page, they note that Rooibos can interact with certain medications like ACE inhibitors, statins like Lipitor, and many other medications. There's a very long list of them. Again, talk to your doctor if you take medications before drinking too much Rooibos tea is what WebMD is advising here. On their page called Dosing, WebMD says, we don't know how much is a safe dose. Again, talk to your doctor. Should Sabrina have only been using one tea bag and not two when she brewed her Rooibos tea? Should Whole Foods give some dosage definitions to protect the public, like, limit to 8 ounces a day and don't make it too strong? Now, that's all subjective, and what constitutes a dose, maybe just let the public know that you're selling them a tea that in rare instances might destroy your liver or worse. I mean, I'm grateful to Dr. Rogers for suggesting an herbal tea as a possible trigger for Sabrina's liver failure. That was enough for Sabrina and the experts to figure out what was going on. But if we hadn't, Sabrina probably would have come home from the hospital at some point and started injuring her liver again by resuming drinking this Whole Foods tea. And who knows at what point she might have needed a liver transplant because she would have kept drinking it, not aware that it was harming her liver. Here's an article from a site called Let's Drink Tea. It's called Pros and Cons of Drinking Rooibos Tea. Read before you drink. It says, while more studies are needed to ascertain this, some cases have shown acute liver failure and hepatitis in people who consumed Rooibos over several years. One patient only recovered his liver function after stopping the tea. Drinking large quantities of Rooibos may cause kidney damage. However, we need more cases for confirming this anecdotal evidence. Certain compounds in Rooibos tea are known to mimic estrogen. This could be contraindicative for people with hormone-related cancers like breast cancer. For the same reason, people undergoing chemotherapy must not drink Rooibos. It could interfere with the drugs in that category. It goes on. At the same time, Rooibos tea is contraindicated in some health issues. For example, people who are about to undergo surgery or chemotherapy must check with their doctor whether Rooibos is safe to consume, since it could interfere with the drugs. Secondly, people with hormone-linked cancers may want to limit or stop consuming Rooibos due to its estrogenic effects. Sabrina's doctors have said they plan to write up her as a case study. She was in the hospital for a week. Her bilirubin, which is one of the liver tests, was almost 19 when she was admitted to the hospital. It should be around 1 or lower. Since she stopped drinking the tea about a month ago, her bilirubin has come down. Right now, I think it's at 4.1. So that is encouraging. We're cautiously optimistic and hopeful she will have a full recovery of her liver function. There's another tea out there called Comfrey that was very popular and which also damages your liver. And I see similarities with Rooibos. Here's a website called thedailymeal.com, and they have an article called 12 teas you might want to avoid. Despite its historical use and reputation for healing, there are critical safety concerns associated with comfrey tea. The main issue revolves around the presence of PAs, which are naturally occurring compounds found in comfrey. These alkaloids, when consumed in excessive quantities or over extended periods, can be toxic to the liver and potentially lead to severe health problems. It's this inherent risk that has led to significant caution and concern in modern times. In light of these safety concerns, it's of paramount importance to avoid the consumption of comfrey tea. The potential health risks far outweigh any historical healing claims. While its true comfrey has been used historically in various cultures, our modern understanding of its potential dangers had brought forth a clear consensus among many health experts and regulatory authorities. Comfrey tea should not be ingested. Here's an article from 2014 from the Today Show. It's called 5 Surprising Herbs That Can Damage Your Liver. Green tea, they say to limit your intake, be aware of EGCG. In supplements, this is a green tea extract. EGCG supplements should be limited to less than 800 milligrams per day to avoid potential liver toxicity and other adverse effects. They also list comfrey and note that it's no longer sold in the United States because of the presence of the PAs, the same things that the weeds we learned can leach into Rooibos tea plants. I personally think Whole Foods should stop selling Rooibos until they can guarantee their customers they won't poison them with it. Kava kava is a root that causes liver damage and is now banned in Britain, Canada, and much of Europe. Skullcap is another suspected of liver damage, and it finds its way into different herbal products. Chaparral can cause liver damage, and people taking it have had to have liver transplants. Rooibos growers that provide Rooibos to companies like Whole Foods know about the risks of their products. Here's a high-end organic tea farm in South Africa. It's called Klip of Mekar. And you can see on their webpage, this is their business, harvesting and processing Rooibos. They have this page called PAs and TAs in Rooibos, Challenges and Solutions. And right at the top, they show a photo of the Senecio weed and the Rooibos plant and how much they look like each other. And they write, 2 of the potential dangers that have been cited as being of concern in Rooibos products in recent years are the occasional inclusion of classes of plant toxins known as PAs and tropane alkaloids, TAs, commonly known as PAs and TAs. These have been a source of concern for some time in the global food and beverage industry. PA-bearing plants have long been known to be the source of dangerous compounds and a concern in agriculture. And then further down, they show how similar the Rooibos plant is to the plant that causes liver failure, and they grow side by side. It says, when samples have been tested for PAs in the Rooibos growing region of South Africa, the plant responsible has been found usually to be Senecio, that's the weed, which can be found within fields of Rooibos that are not diligently cleared of the weeds. It talks about the dangers of Rooibos contaminated this way, and they write, what we as organic Rooibos farmers at Klip of Mekar are sure of is that our specific farming and processing methods reduce the chances of any contamination to almost zero. Almost. And this is because the problem species of plants are identified and removed before they can make their way into our Rooibos harvest. Then it says, another common way in which Rooibos producers eliminate PAs and TAs from their harvest is to identify problem plants in the field during harvest time and to train harvest workers to be sure not to accidentally harvest such plants as part along with Rooibos. In summary, when clients require it, Rooibos producers can ensure that their products meet worldwide standards and concerns related to PAs and TAs. The South African Rooibos Council has defined best practices, and the issue remains one that is given constant attention. Tea brands that are concerned about TAs and PAs are supplied with appropriate product. Unfortunately, in our case, it appears Whole Foods was not supplied with appropriate product, but with product containing the poison. It might be wise of Whole Foods to add a safety label to these products, that there's a chance toxins could be in these teas despite efforts to prevent that. And if you suffer from any liver dysfunction or liver failure, to immediately discontinue drinking Rooibos and inform the liver specialist that you were drinking Rooibos. I know my wife would never have bought this tea if she had been offered some kind of informed consent. She would not consent to purchase a product that had even a small chance of harming her liver, or even if this was extremely rare. A warning label, of course, it might impact Whole Foods sales a little bit. They might not sell as many, but it also might save some people a lot of pain and injury and expensive hospital stays. I'm putting links to everything I show in this video into the description down below. I wouldn't want anyone else to go through what Sabrina is going through. And if you do drink Rooibos tea, very often it might be wise to get, liver function tests from time to time. I mean, Would you want to have 50% liver function, and not know it, that you were damaging yourself? How would you feel about being prescribed a medication and then discovering that your Rooibos tea habit made the medication ineffective or less effective, and that led to, health complications? This is serious stuff. We know from case studies that this kind of thing is actually happening. Okay, that is today's video. If you learned something useful, please give the video a like, share it with friends and tea drinkers you may know, and consider subscribing. Thanks a lot.